Women and Health, Convention on the Elimination of All Forms of Discrimination Against Women.
Hi, my name is Meghan Hoyt and I work at the WRDA and I am the Women's Policy Lobbyist Assistant.
CEDAW Article 12 sets out women's rights to equal access to healthcare and to non-discriminatory health services. From your perspective, how well are those rights being realized in the local context?
So Article 12 is really important in terms of a woman's right to health. Article 12 in CEDAW really reframes the idea of women's right to health as something that is part of a wider project to address gender discrimination. So it's not just a right to health, but it's part of a wider puzzle. And that's really important because from something like that flow a bunch of international obligations on states. And so you get the Beijing Declaration in 1995, which really lays out a roadmap and some principles around women's health. And signatory states then have obligations to implement this roadmap and these principles in their own countries. And so, for example, you get a country like Canada that implements its first women's health strategy in 1999. That's almost 30 years ago. And so a place like Northern Ireland that still does not have a women's health strategy, you can see how far behind we are when it comes to a women's right to health in this part of the world.
What are the barriers women face to accessing healthcare?
So one of the biggest barriers that women face to accessing healthcare is the patriarchal nature of healthcare itself. There is a long-standing bias towards research and knowledge around women's bodies, and also a dismissal of women's pain and symptoms. And this impacts differently situated women in different ways. One example of this that came out of WRDA's recent research into a women's health strategy was the key theme that emerged around women's access to gynecological and menstrual health care. So, for example, there is a 9-year waiting list when it comes to a diagnosis around endometriosis. And this really highlights the lack of research and the lack of accessible pathways when it comes to women accessing this vital form of healthcare. So that's one of the ways in which these barriers sort of manifest in real life.
If there was one key ask or policy change that could most effectively advance women's equality and rights, what would it be and why?
So in the area of healthcare and in Northern Ireland, the one key ask would be the development of a women's health strategy. We are the only region on these islands that is currently without a women's health strategy. And this would be beneficial for a number of reasons. Data would be held centrally, services would be easier to access, and a real spotlight would be placed on women's health and equality.